What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a repeat guest. That means 3 times. Actually, you might be on here more. So this is Dr. Leonard Pastrana coming out of West Palm, Florida, owner, creator of the new Bio Age provider network of education and awesomeness, founder of the Gut Tides. Let's see. I don't know. That's all the important stuff. Also, he has put together an amazing conference. I got to speak at one of the ones this year. So this podcast will probably air in 2025. So I got to speak at one of his conferences in 2024. And it was such a cool opportunity because it helped practitioners learn from the people who are actually doing it in clinical practice. And not only that, taking home actual applicable protocols. And I've gotten the opportunity to get to know Leonard and his team really, really well. And one of the things that I will say, and I think this is why we get along so well, is that the business side of medicine can be difficult to navigate. And I think, partnering with different pharmacies and educational groups and supplement companies who really help practitioners take the business side of it to the next level. And I feel like that's a lot of what Leonard's goal is. And he's such a great educator. Sometimes he gets a little nervous on stage, but he's getting so much better at it. And I love to give him so much shit about it. But welcome, Leonard.
Thanks for having me.
Yeah.
Again.
Yes.
Glad to be back.
Again. I mean, there's so many topics we can cover. And it's so funny when people are like, I could listen to you guys talk all day. I'm like, listen, you don't want to do that because a lot of it is nonsense. And there's probably about 10% of it that's actually helpful. So, all right. So the goal of this podcast, so I've been posting a lot. I just finished my slide deck for Calm 2025. I'm so excited to have the opportunity to share a little bit about testosterone replacement in women and its impact on longevity, body composition, quality of life, sleep, mood. Like there was so much research that I was like, wow. I mean, I feel like I know a lot about hormones, but man, I definitely learned a lot more. And not only that, it forced me to look at studies that I wasn't looking at. To one of the conversations Leonard and I had earlier this week was, there's not a lot of research when it comes to testosterone specifically for women. Why? Because it's not FDA approved. So some of the studies I was looking at was testosterone given to trans men, so women transitioning into men. And the data is great. The data is really good. So I love it because every time I get to speak, it forces me to look at research that I hadn't looked at before, just brushing up on the current research. So always pushing me to be better, just like I try to push him to do a lot of things he don't like. All right, Leonard. So here we go. So tell us a little bit about what is Calm 2025.
Sure. So CALM stands for the clinical application of longevity medicine. And the key word there is clinical, right? So there's a lot of conferences on longevity. There's a lot of influencers talking about longevity, but what we want to get together is practitioners that are doing this every day and the clinical application of longevity medicine. Because like as you said, as you were looking into testosterone, what we're doing is we're diving into the literature and actually seeing, what is the evidence behind what we're doing out there. And we want to put together education where medical practitioners can come and learn about how do I do this clinically? How do I do this the right way? And so we decided we were going to put a conference together, but we wanted to do it right? So, there's 3 key things that we wanted to do with this conference. One, we wanted to talk not just about the compounds, not just about the ideas behind longevity, but what is the practitioner actually need to deliver longevity medicine, right? And so they need to understand how to identify risk, right? If we're thinking about longevity, it's not only your lifespan, how long you're going to live, but your health span, the quality of your life right now. And so doctors, physicians, medical practitioners, anybody that's engaging in patient care has to be great at identifying how we can help people in the moment and how we can help people in the long term. So one of the things we want to do is bring in all the diagnostics and tools that our practitioners are using to identify that risk and to use the information that they're going to use to put together treatment plans. So we have anything from like body composition, metabolic breath analysis. We have people coming in to talk about genomics and how they actually use it. Looking at AI and CCTAs for preventative cardiology. We have new biological age testing speakers coming in. So there's a lot more going on, more than just methylation. So really good presentations about how we can look at biological age per organ system. So some really cool new stuff that's on the horizon. But the second part of that was that we actually wanted to bring not just good educators, but educators and practitioners that are doing this every day in their practice, right? So you have to be good at teaching and you're actually doing this every day in your practice. And of course, that's why we called you first, because you're the perfect example of someone that's not only doing it every day, you're living it, but you're an amazing educator. And so what we've done is we've been going to a lot of the same conferences for the last 3 or 4 years. And we've just been kind of hand selecting all the best educators, all the best people that had the biggest impact on how we do things, and put them together all in one conference. And then the final thing that was really important for us at Calm is we want to just not impress practitioners that are coming to learn, but we want them to leave there on Monday morning, be able to apply this. And so then the third big aspect of it is, how do we deliver longevity medicine? Everything that entails, because that's a lot. That's anything from educating your staff to what companies do you partner with, what pharmacies do you partner with. There's 55 different gut tests out there. Which one do you trust? Which one are you looking at? And so we wanted to invite all the companies that our practitioners are using, that you're using, to be all there in one room so that we can talk about how we actually deliver longevity medicine. And so it's going to be a lot of fun.
I'm so excited. So excited. So when we were in Cabo back in August, maybe September, I don't remember, you and I had a conversation. Now, granted, there was some tequila involved, so I don't know if you remember this conversation. But so Leonard's brother is a coach, and coach in basketball. And so he's like, this is kind of like my version. Like, I'm building this amazing roster, kind of like my brother does in basketball. And I'm getting like all the best players, all the best educators. And I'm building this amazing team, because I can't tell you, just as Leonard said, we've been to a lot of the same conferences, and we can kind of look at the agenda and be like, oh, they're going to be good. Okay, I'm going to go take a bathroom break when this one comes on, because I already know, it's the same spiel. You've heard him speak so many times, but it's like finding the practitioners who update their slide deck, or like, hey, I just started adding this into practice. Like Dr. Faree is going to be speaking on neurotherapy, which I absolutely love neurotherapy. And at some point, Leonard, you're going to let me inject you somewhere. Okay. But it's amazing. So, and I've heard Suzanne speak so many times, like she's a personal mentor of mine. Like I could literally hear her talk all the time. But those are the types of people that Leonard and his team have found to come here. So he's building this amazing roster team. So I was telling Min that we had this conversation. I don't know if you remember telling me that. Again, it was like at the end of a long day.
It sounds familiar.
And I said to Min, I'm like, okay, so if we're the Chicago Bulls, like, which one am I? He's like, oh, you're definitely like Rodman. You're like the wild card that, like, you don't know what the hell she's going to say next. She might say something real ass backwards, sideways, and be like, look it up. And it's actually in the literature. So I was like, oh, okay. I was really hoping for maybe somebody different, but that's fine. So let's talk about the audience. So I had a physician reach out to me, and she's new and she's been doing aesthetics. She's like a Galderma trainer. She's a retired GYN, just added in hormones. And she said, would this conference be like too far advanced for my level, or do you think I'd actually benefit? And I said, that's actually, in my opinion, what's going to be really cool about this conference is that it can appeal. Like, if you've been seasoned, you're going to get something out of it. If you're new, you're going to get a lot out of it. So I do think it's for anyone who's interested in helping patients achieve longevity or improving their health span. Is there someone in specific, Leonard, that you would think this would appeal the most to?
No, I would say that it's a really wide range, right? And this is something that we talked about. Anybody from you're just got started in this world, or you've just been doing GLP-1s and you've been focusing on weight loss, and now you need to pivot that more into longevity medicine because this is what your patients are looking for. Anybody from that space all the way into up to, I know if you weren't speaking at this event, I have a feeling that you'd be at this event. Even practitioners that have very much big thriving practices that have 6, 7 other practitioners in their practice. This is going to be the perfect event to go collaborate and also get your team and other practitioners in your practice to get up to speed to where you're at. Because that's the other thing that's a big aspect here is it's not, a lot of practitioners, they try to do it all themselves, right? And you can only see so many patients. You can only trade your time, you want to trade your time for money. It all becomes about you being able to scale your practice, all becomes about how well you can teach other providers and other people in your practice. And so this is the perfect scenario as to be around and collaborate with other practitioners like yourself that have scaled and expanded the knowledge, not only for their patients, but the knowledge within their practice, because that's really the rate limiting step for you to grow. So it's a really wide range. I think anybody from the beginning to very successful practices are going to get a lot out of this conference.
Yeah. So let's talk a little bit more in detail of kind of like the format. So it's a 2-day event. It's February 28th through March 1st. It's going to be in Miami. It is at Four Seasons.
Four Seasons, yes.
I was like, I know Leonard's bougie ass. So we're probably at the
Yes.
Four Seasons. Yes. And so let's talk a little bit about maybe some of, so I know we kind of brushed up on like the potential topics. Can you talk a little bit about maybe some of the speakers?
Sure. So I talked about the diagnostic side of things, right? And so when we're going to have those speakers that we're mentioning, the ones that are doing this every day in their practice. So we have speakers like Dr. Elizabeth Urth, who is amazing at a number of different things, but really where she specializes in the repurposing of compounds and repurposing of drugs. And so one of the things that we want to talk about in a lot of these different talks is, well, how do you combine these different therapies together? Now, we love peptides, so we'll be peptide therapy focused. But the big question is, well, what do I combine with this peptide? What supplement, what repurposed compound can I utilize? And so she's going to have a great presentation on the repurposing of compounds. A lot of the speakers are going to be talking about repurposed compounds. She'll be doing inflammation. We'll have speakers like Robin Rose and Cynthia Keller, who are experts in long COVID. Really excited for that. They've done a lot of amazing work with long COVID patients. It's something that I thought, maybe we were getting past, but they've really opened my eyes with the research as to how many people are really suffering from impact of long COVID that we don't even realize is long COVID. And so there's some of the world experts when it comes to long COVID. We have Dr. Abid Hussain coming, talking about preventative cardiology, talking about the new compounds that are coming out. We have Dr. Dan Goodenow, who is a PhD researcher, coming to talk about the brain. We have, like you said, Suzanne Faree coming to talk about protein. And I'm so glad that you brought up Dr. Suzanne Faree, because Dr. Suzanne Faree was one of the first physicians. I walked into a peptide certification course that basically changed my career for me. I went in there and she did such an amazing job in those presentations that I completely pivoted my career. So she was one of the people that inspired me very early on to get into this world. So an amazing educator. To have her speaking at the event is awesome. We have other speakers like Dr. Laura Lyle, who is an expert at genomics, and how she takes genomics and how she takes a number of different things and uses that data to optimize her patients. She's got really cool case studies that she's going to talk about on how she used genomics to identify who actually needed a Clearly test, right? So young patient, you would never think that you need this test, but the genomics clued her into that she needed further testing. So really cool case studies there. We have some of your favorites. I know guests that you've had before, like Dr. Greg Jones will be coming in talking about sleep optimization. Dr. Chris Wusterhausen, who's amazing at talking about all the benefits of GLP-1s. We have another one of your friends, Dr. Azza Halim, that'll be talking about biostimulators and exosomes. I hope I'm not missing anybody. I'm probably missing a couple people, but it's going to be exciting. I'm going to be talking about new compounds that aren't even available yet. There's the next generation of GLP-1s. We have new small molecules that aren't available yet, but I think around that time period, they're going to be available. So really exciting stuff for the future.
Oral testosterone. We're talking about oral testosterone.
Oral testosterone. Yes. Kysotrex. So there's a new oral bioavailable form of testosterone. So we're going to have people from Marius Pharmaceuticals there speaking. We have a CEO speaking about longevity compounds. We have one of their chief medical officers talking about oral testosterone, which I think is going to basically revolutionize hormone therapy. The same way GLP-1s were a big wave when it came in, where traditional medicine started to come into our world of longevity. I think the same thing is going to come in hormone replacement therapy, specifically in men. And so they're going to talk about that new bioavailable form of oral testosterone. And then you're going to be there also talking about, not forgetting testosterone in women, which is something that I think people are a little nervous to, talk about, right? And I was like, well, I know exactly who is not scared of anything and who will definitely come here and talk about testosterone in women. So a lot of fun talks going to be going on.
Yeah, I'm super excited. It's like all my favorite players on a basketball team. It's like what is it, like superstars, like, the best of the best, right? So I think that's great. Yeah, the dream team. So I think it's awesome. I think it's going to be really good. So just as Leonard said, if you're just starting out or if you're seasoned, I think there's literally something for everybody. And one of the things that I think Leonard really finds value in, which I will agree, is that sometimes the best conversations you have are outside of the conference. It's the networking events that maybe happen that evening. It's the sharing of, hey, I had a case like that, or did you think about this? Like that's probably where you get extra pearls and nuggets of information where you're like, huh, definitely came out with this whole new idea. And I feel like so many times I get back to the office and my staff's like, okay, what crazy shit are you going to do now? So I think it's great. So I think it's going to be a great conference. The team that Leonard has working with him, top notch. Like I've got to experience a lot of the work that they've done. So I think it's going to be so good. So how can people sign up, Leonard?
So it's called, the website's wearecalm.life. And you can register there. We're going to have a Black Friday special, but if you go there right now, the Black Friday special price is already there. We just haven't announced it yet. So you get $200 off the registration. So just head over to wearecalm.life.
Perfect.
And
I will
register.
I'll tag all that in here as well.
Yeah.
So we've got that. And then, Leonard, if people want to follow you, where is the best place to follow you, Leonard? Listen, don't let me down. We've been working on this for 4 years, Leonard.
I think it's at Leonard Pastrana on Instagram.
Yes.
It is?
And
all right. I got it right.
Yes, it's at Leonard Pastrana. And then
At Leonard
I will
Pastrana.
I'll also tag all of his socials. He didn't have many, okay? Like most of his Instagram is pictures that I've tagged him in, okay? So we'll just put that out there. But thank you so much. No, I'm so excited. Any final things? I'm like looking at my notes here. I feel like we've covered everything that I wanted to kind of take away in that, I got an influx of people like, should I go? What do you know? And I'm like, you know what? We're going to get Leonard on the podcast so we can have an episode to help showcase to practitioners what are some of the benefits. And then if someone wants to join the New BioAge Network, what's the best way to do that?
So you can go to newbioage.com, register your practice, and that's where they can get education. They can get linked up with our network of pharmacies. They can get linked up with other educational opportunities as well. So one of the things that you mentioned about, how important it is to be at a live event is the collaboration or the conversations that you have after the talks. And so the talks, as amazing as they are, some of them are 30 minutes, some of them are 45 minutes. It's like you can only talk about so much. Where the real magic happens is that those talks, those presentations, they stimulate more questions and they stimulate more conversations later. And that's the priceless part of these live events. The other reason that you want to be there is that we're going to be announcing something for the first time where we're going to take education a little bit further with a longevity certification. So that's going to be the first place that we announce it and make it available.
Okay, so longevity certification coming soon, 2025, right?
Yes.
Okay. All right. Anything else?
I think that's all I got.
Okay. All right. Well, you heard it here first. So I'll make sure to tag all the socials, all the websites. So if you're a practitioner and you're wanting to get signed up, be sure to check out the link in the show notes, as well as the tag that will be with New BioAge. Thanks, Leonard.